Top 10 Cancer-Causing Habits. 1. Smoking, air pollution. In heavily polluted cities, residents can inhale in more benzopyrene in a day than smoking 20 cigarettes. Particulate matters suspended in polluted air are closely related to cancer, especially lung cancer. 2. Staying up late. The natural cycle of melatonin is disrupted when a person stays up late due to getting exposed to artificial light for extended periods of time. Light exposure during nighttime decreases the production of melatonin, a substance that protects DNA from being oxidized and destroyed, thus inhibiting the development of cancer. 3. High meat diet. A study in the UK shows that excessive consumption of processed meats increases the risk of breast cancer. Those who prefer meats over vegetables have a higher risk of colorectal cancer than the average person. 4. Frequent cell phone use. Electromagnetic waves emitted from phones can alter the brain in mind-bending ways. According to an Israeli study, the side of one's head that is habitually used to listen to one's cell phone has a higher risk of developing salivary gland cancer than the other side. 5. Overeating and obesity. Some cancers are associated with obesity, such as colon cancer, endometrial cancer, prostate cancer, and breast cancer, which is why we should pay attention to our diets, exercise frequently, control our weight, and reduce fat accumulation. 6. Eating high-temperature foods. A lot of gastrointestinal cancer patients, especially esophageal and gastric cancer patients, have a preference for high-temperature foods. 7. Negative emotions. Serious emotional traumas and depression can cause psychological stress and further lead to physical imbalance. This will lower immunity and give cancer a chance to gain foothold. 8. Lack of exercise, frequent sitting. Life requires movement. Only through exercise can one effectively reduce the risk of obesity, diabetes, cardiovascular and cerebrovascular diseases, and cancer. 9. Holding in urine or bowel movements. Constipation will cause stools to remain in the large intestine for long periods of time. As a result, carcinogens in the stool will have more time in contact with the intestinal wall. Cancer will be induced if the problem continues. 10. Binge drinking. Binge drinkers are 10 times more at risk of liver and esophageal cancer than those who don't drink.